بسم الله الرحمن الرحيم.
Allah, the most merciful and most compassionate, Your Excellency President Abdel Fattah al-Sisi, the President of the Republic, and is indeed allow me, sir, to explore the purpose of the Minister of Health and start on a very important question of big concern, which is, does the health sector among the priorities of the Egyptian state in expenditure and addition in 2014 till now, and some pivots related to the mega national projects adopted in the last 8 years and its direct and indirect impact in improving the Egyptian health citizen, and how the world would see the size of challenges faced by the Egyptian system as the output of expenditures on the health services provided. Start directly with figures that are frozen, balance sheet, and the size of development of the health sector in 2014 till now, and the size of governmental expenditure that started from 32 billion and led to more than 120 billion Egyptian pounds. Development expenditure that reached even doubles of the start in 2017. We'll explore where this money can do throughout the sectors and the provision of developed services. Around 170 billion Egyptian pound is the size of the health sector. If we look at the national projects throughout the Republic, whether in Suez Canal and the social housing, railways, food security, universities, and the slums being developed and transferred into housing projects, do these projects have a great impact on the health? In few examples, the physical and psychological health of the human being had changed through the transformation from the slums into a very healthy housing. The rates of traffic accidents and this had totally differentiated through the road traffic of the road network being disseminated, as well as the food security that at large affected and the social determinant of health, that's what we call it in the health. It's not only the health is represented in the hospitals. Hence, we started in a question of the scientific platform that of the ChatGPT, which are the open results of the AI that gather all the information from all international resources, and we've asked such a report that rely on the machine learning and the digital learning process through what are the social determinants of the national projects since 2014, and the engine indicated opportunities improving public services, economic development, and the improvement of environmental and living circumstances through projects being established since 2014. In such a context, proved the improvement of the health life of the citizen. And the second question, how the world sees the development of the health sector. We've already resorted to several articles recently in Forbes that indicated and praised the Egyptian expertise of the elimination of the virus C and compared what is happening in the USA by indicating the outcome of Egypt even though the United States never managed to overcome such a crisis, despite the expenditures of $4 billion in it, now into the USA is in need of $11 billion US and more than 10 years to overcome such a problem. Also, we've already tackled to shouted to the rockets and asked how the medical economy since 2014 till now, and the engineers started to describe what has been laid or what has been done through the comprehensive health insurance in 6 governorates, what happened through the primary care and the integration in different measurements, as well as the public health initiatives. And when we indicate them that played in a very escalated development in services, and these are the whole answers answered by the ChatGPT in the such we've already asked does not only thing is clear and nice, but we still have a lot of challenge, and since we've already started about the challenges in the health sector, of course, indicated to the unbalanced distribution and the weakness of the infrastructure due to the oldness of the hospitals and the shortage of the medical cadres that which the country is suffering, as well as the demographic challenges represented in the increase of population. And here I had a pause of the increase of population that is considered as the biggest challenge in Egypt, not only in the health sector, but in different sectors in general. If we talk about the increase of the population, we could imagine in the 1st of June, the population had reached, according to the reached to 105 million people. Egypt, more than 5,000 new child is born, so around 4 billion every 1 single minute. If we took out the language of numbers, if we consider that in each day and less than 2 days, around 40 hours, 10,000 new babies born. Focusing in the 10,000 is costing how much the Egyptian state per day. In a daily, we take about 9 beds and health unit of 27 million Egyptian pound, and school classes of 87 million Egyptian pound, and vaccination is 6.8 million Egyptian pound. The vaccination is costing Egyptian government is 2.7 million Egyptian pound per day. Back to the question, so was the health amongst the biggest priorities of Egypt since 2014? Through these figures, we are see that we are in dire of school classes and university and schools, and we're talking about how much of billion to be provided per day if we consider dealing with the daily increase. Despite all the children are not born healthy according to the world percentage, some newborns are in need of treatment of chronic diseases. I consider, as considered by the biggest writer, Gamal Hamdan, is the biggest challenge of the Egyptian state. What has been done? The health ministry strategy, they relied on a scientific plan in establishing centers and hospitals with great concern the health, the medical sector, and the nurse and technicians, as well as the provided health services. If we talk about the infrastructure, it will find like 965 million project. Therefore, none a single government is working only in projects in elevating efficacy, which is in a full and cost of the new establishment. We're talking about 53 hospitals of 37 billion Egyptian pounds. We're talking about 13 hospitals to be established in the upcoming years. We're talking about a map or a plan according to the health plan in the upcoming 10 years till 2024. This was the regular theme. Still, some hospitals are still suffering of this features. We've exerted all the efforts in 2014 through the support of the Egyptian leadership and government in order to reach what we are longing for. It is that simple. We are working effortlessly by the witnessing of the whole world of the size of development within the establishment. We're talking about the medical services provided to the citizens within the hospitals. But what you are seeing, it is a reality that exists in different governorates, whether they are witnessing or including development and the health insurance in order to reaching the phase of development for the whole health system throughout the Republic. An example of the SIRS complex, as mentioned by Dr. Baha, this would never stop us. As mentioned by Professor Jonan, we're talking about the control hub of the African CDC. We've established following the COVID-19 with Egypt CDC, which is a great innovation of the scientific research in confronting pandemic in order to be prepared in the upcoming pandemic in the future. And also, we've paid concern over the primary health care that is emanated throughout the Republic, and Mr. President clarified a great project in developing all the health units throughout the Republic, in each village and center, through Decent Life Initiative or some other project, and through such the primary health care to provide all the health care throughout all the members of the family since the newborn, in order in reaching the care of the health care of the elderly citizen people. We started establishing 231 healthcare units by the end of 20, in order to reach the 500 or 5,400 healthcare units. Also developing the project in order to meet the main pillar of all the governorates, such as the medical city of the Nile medical city in an institute, in order to be the Middle East destination in the position in a very distinguished healthcare with more than 45 operating rooms within less than 2 years. Will be ended in Nasser Institute. In such, we've already worked in the National Heart Institute, and Mr. President certified to establish a new institute outside the Cairo Governorate. And the same thing goes for the central developed labs, all being clarified through numbers and figures in answering the question, does the health system was and still amongst the Egyptian priorities in expenditure and support and subsidies, like other projects started by the country. Also, a psychiatric medical city. Mr. President also ratified to establish two medical psychiatric hospitals in Burj Al Arab and Cairo of a total cost 5 billion Egyptian pounds each, in order to innovate services that started 50 years ago. And if we reach these health services that has two parts in dealing with the speedy one, that was the first one of escalating outcome, and long and short range initiatives and plan that reach 14 presidential initiatives throughout all the medical disciplines, among of which, if we're talking about the virus C, and we have Professor Al-Tur, who discovered the virus. Such one single initiative that cost the Egyptian state around 32 billion Egyptian pounds and served more than 90 million Egyptian citizens. 92 million Egyptian pounds and 132 service, not only through examination, but examination and the follow-up and the treatment. Even the rates had increased of 92%. And we've never seen the new cases, only a few cases are left, and the Egyptian state committed to provide the required pharmaceutical medications in order to eliminate the diseases. 11 advanced measurements have been laid out that costed Egypt around 15 billion Egyptian pounds. Whenever we asking for a subsidy of such a very important initiative, speedy response were there as a result of the increase in the price of the foreign currency. As I mentioned, the rate of using US dollar is around 80%. Even the numbers I say it in Egyptian language, yet the US part is 80% of the cost, the whole cost. Of course, the treatment and the state costs. We've issued 3.1 million decrease, and we're expecting due to the price differentiator to reach 20 billion Egyptian pounds. This is a great expenditure from the states, backed by assuring you the concern of the Egyptian state in supporting and subsidies the health sector. It's all okay if we're not seeing the outcomes on the health. There are universal and performance indicators. I indicated the rate of the dissemination of anemia diseases, such as well as the breast cancer dissemination and how to control it in a very early stages, instead of reaching and discovering the oncology diseases in women that was more than 70%, and now we've reached it in a very advanced phase, it's around 29% in a very early stages. The same goes for the rates of mortality. These are universal indicators that measure the health performance through the presidential initiative, not only us, but the WHO sending committees to tackle this issue. We've already started by 6 governorates, and the second phase to be include of the very intensive 5 numbers to be prepared with the cabinet in order to entering new governorates in the upcoming phase. We've never stopped, but the Decent Life initiative that provide a decent life for more than 60 million Egyptian citizens, a big part of it that is related and concerning of the health care. I hope through the aforementioned presentation to answer the question of the importance of the initiatives to be amongst the state priorities. And if you have if you are healthy, you have a hope, and if you have the hope, you have everything else quoted. Any orders and directives, Mr. President? Well, excuse us, Mr. President, in breaking start into the tour. Allow me for just 2 minutes. In the name of Allah, allow me to welcome you all in the ExCon in its 2nd edition, wishing you a very pleasant stay in Egypt and the whole success of all proceeding activities during the ExCon. Allow me to tell you that we also wish to extend thanks for all participants and contributors of its ExCon, and this is Egypt's keen since the announcement of the 1st edition to Egypt to play in a very positive role in a very important issue, which is the health in Africa. And we see in very humble way what has been mentioned by Minister of Health. Our expertise we've gained in a very similar circumstances of Africa. We are not a very advanced economic countries, and therefore the health system, as said before by Dr. Jaya, when he mentioned that the COVID-19 that showed the vulnerability of the health sector in African continent, and which is true, but through the coordination between Egypt and African countries, we've managed to improve the very moderate capacities, as mentioned also by Minister of Housing, through the mentioned initiatives are, as I wish to say in Egypt, our population is 105 million, and according to the world standards of the size of hospitals and beds, we should increase what we have already to be doubled. If I say an unforgettable number, if we are in need of 500 hospitals, therefore we are in need of 1,000. The same goes for all medical crews. But we're not going to do so, regardless of the causes. Aren't we going to stay still before the health challenges? I'm talking about the Egyptian experience, which is available for our brothers. We've targeted such disease, as I mentioned, that has had a very negative impact on our families, and thankfully we've succeeded, and even within a few coming weeks to announce that Egypt is fully free of such a disease, and also other initiatives that's main goal is to intensify Egypt's efforts with very specific medical issues in order to improve the Egyptian health, giving into considerations our capabilities. Such initiatives such as the waiting list, when was offered, they were talking about 12,000, and now we are talking about 1.9 million lists through 4 years. And the number was less than mentioned by Dr. Khaled, 15 billion. There are actually 20 billion Egyptian pounds. Therefore, I wish to thank the civil societies and the donors being provided, such as 4 billion Egyptian pounds. Therefore, initiatives are ideas is trying to solve the very difficult challenges in order to improve the health of the people. Allow me to send my condolences to the death of Dr. Ahmad, who died yesterday. My deep condolences to his families and relatives, and allow me just to say that he had a great contribution during his tenure working in the Ministry of Health. Allow me to send his condolences. Once again, I would like to welcome you. I wish you very successful and important and fruitful proceedings of the ExCon, and allow me also to say that there is a great opportunity in this time to be part of an entertainment and by visiting different and touristic destinations, and welcome you once again. Very pleased to have you here, and thank you very much. Thanks, Your Excellency, Mr. President. And now we'll excuse us to start the expansion to